Now I'd like to bring on our next guest, Bill Hennessey, CEO founder of Pratter, a transparency solution provider. Bill, good to have you on the program.
Well, thank you. Appreciate you having me. It's Pratter. It means price matters. It Pratters. But are we going to have a field day, a Pratter day, or both today, gentlemen?
We're going to have both today, and it's always good to have an OSU alumni on the phone with me too.
The Ohio State University is well represented today, so let's do them proud, gentlemen.
You got it, Bill. Hey, listen, to our audience that might not know you and your group, give us a little background on yourself and the creation, of Pratter.
Well, it's this simple. The problem is skyrocketing healthcare costs. The cause is secret pricing, and the solution is Pratter. And what we have done is worked as a team to make employer cost data go to two places at the same time. First, to a medical cost savings analysis so that an employer can manage what we measure, and also become searchable by zip code so that you can see as a consumer the charge as well as what the insurance company pays, the claim allowable, if you will, or the negotiated discount. It should be there for all to see.
Yeah, I agree. We can't have consumerism without true transparency, correct?
That's true. And the definition of true transparency is the known charges as well as known insurance payments before the time of service. A health insurance company serving as a TPA wants you to believe that a false out-of-pocket estimate with a wide range counts as cost transparency. I'm here to tell you, it just doesn't.
Yeah. So as you look at where we move with adoption of transparency, and there may be a better term too, but I guess we'll use it for right now, right? What do you see some of the roadblocks out there that you're helping get by, and roadblocks that we need to get by? There's regulatory hurdles, et cetera. It's the contracts behind the scenes. I mean, talk to a little bit about some of the roadblocks and where you see us making a little progress there or not.
Well, the answer does lie with employers that are self-insured, whether that's in the private sector, cities, counties, unions. They own their data. So the end around is to use their data and make it transparent and searchable by zip code for all of their employees, as well as to give them a cost savings analysis that lets them know their single most expensive cost item, their second, third, fourth, all the way down to up to 600 we track. And those high cost items are targeted. In terms of hurdles, there's two, really, right? There's hospitals and there's insurance companies. They, in general, have not wanted to disclose what they charge and what they pay. Right now, they're answering to each other and not us as consumers. I do see that changing, though. Pratter is founded by medical providers. Again, I am an MD. I do own a physician medical billing company. My father is the foundation director of a community hospital. And community hospitals can't afford to just remain silent on their pricing and quality. Put those two together, that equals value. That needs to be out there on behalf of community hospitals if they want to put the care back in their community, because they're just getting hammered by the big city hospitals that put on ad campaigns and drive those people with the perception that if you go to the big city, you get a better care.
Do you see, with your initiatives with Pratter, Bill, and your connection with the self-insured employers, do you see more and more of these employers' light bulbs going off and saying, hey, we can move the needle because it is our data?
Yes. The biggest shocker for them is the fact that in-network pricing varies by a lot. The perception is if a TPA has some negotiated discount, there can't be that much pricing variability in network. And even for an employer as small as 350 recently, we showed that had they used the lowest pricing on Pratter, there was a potential $1.4 million savings on the table. And then they didn't believe that, and so we said, we're just going to show you your own little in-network, not including the better deals that can be found on Pratter. And if Joe and Bob work for the same company, but they got the same care at the lowest price instead of one at a $3,000 price tag and one at a $1,000, there was still a $500,000 savings on the table in network. So they're just absolutely shocked that there are times in which they're not being fully serviced when these prices remain hidden so that they don't know where the best places are to go for care.
Hey, Bill, when did Pratter first deploy your solution to the market?
Q2 of this year, after about 2 years of IT development and data acquisition.
Okay. And talk to us about your business model, because I think you have a unique business model. Tell us about your business model. If I'm a self-insured employer listening to this program, talk to me about, your business model.
Well, first, to show that there is a quantifiable return on investment at no cost for any and every self-insured everywhere, we will perform our medical cost savings analysis. Once that ROI is quantified and we know there's interest, we do have a PEPM pricing model, which is typical in the benefits industry. Pratter is sold as an employee benefit, and so that's per employee per month pricing, and that will include our cost savings analysis. We'll do that quarterly so that it can be managed, these specific high-cost items. Unlimited searches for an employee and his or her family to save on care throughout the year. A Pratter savings card customized to the zip code so that they can keep it in their wallets and purses of the known lowest cost providers in their network. And if for those that have a low deductible, a dollar figure can be assigned as a financial incentive on those categories of blood work, imaging, and elective medical procedures. So Pratter is specifically targeting 600 cost items that make up the fixed commodity outpatient market, where there should not be much difference at all in terms of quality. But there is in pricing because it's been hidden.
And Bill, you're focused on what markets right now? I mean, if I'm in San Jose, can I do business with you, or what markets are you focused on right now?
Well, right now our best market is in the tri-state area of Pennsylvania, Ohio, West Virginia. We do have a pretty good cost database out in California and Arizona, but we're happy to do these cost savings analysis for any company. And as we've shown recently in Ohio, we can save $500,000 for a group of only 350 in an area of Ohio where we didn't have strong data, just by letting them know about their own pricing variation in network and publishing it on our platform. That's the possibility of an ROI exists everywhere. It's probably strongest right in the state I'm in Pennsylvania.
Yeah, that's very interesting. So in your distribution and your outreach to the market, are you reaching out to brokers and advisors to working with them? Are you primarily going direct to these self-insured employers, other channels? I mean, obviously we've talked about exchanges as potential markets. So what's your distribution plan right now?
Well, sure. Since the employer is our customer, we do go to employers direct, and we go through business associations. We also are partnering with some brokers, and also have discussions ongoing now with non-insurance company third-party administrators who have nothing to fear. By working with us, we're on the same team. We're offering services that health insurance companies will not ever offer as a TPA, and we can work together with them. We realize that... Go ahead.
I'm sorry, Bill. I didn't...
No,
so you're working with the independent TPAs.
Correct.
The independent
That
TPAs.
is correct. Okay. Yes. They're much more willing to provide a service and work in coordination with us than an insurance company that's a TPA. We love working with the independent TPAs.
So talk about the competitive landscape as you look out there and where you see the market going.
Well, right now, it's a $3.3 trillion industry, so of course there's some competition, which is okay. There's just more than Ford and Chevy when it comes to cars, but the competition has chosen to partner with Blue Shield. So if you either are the insurance company or act like the insurance company, look what's happened to the cost of health care. So again, my point is out-of-pocket estimates don't help a self-insured company manage its costs. When we list their top 10 cost items by total expense and then by frequency and show them how many millions they can save, and they know to the dollar what each one of those costs and which hospitals and surgery centers are being utilized, that is actionable. An out-of-pocket estimate in hiding what it really costs is not actionable. That's, and we are partnering with community hospitals too. Other than employers, look, if we go and get the data directly from community hospitals and put it on our platform and give them a price tag guarantee and preferred listing, they now also get a glimpse of what their competitors are getting paid. So we have become community hospital and independent surgery center friendly. Remember, I'm a medical provider. I'm reaching out to other medical providers to help keep the community care in the community.
Yep. And we have providers coming together closer to employers too. I mean, the whole direct contracting is going to have an impact on this market too, correct? And around costs.
Yes, and any self-insured employer that's contracting directly with a hospital system or surgery system or a physician group could put their pricing directly on Pratter and make it very easy for their employees to search it by zip code. 2 clicks, they're done. And so the local hospital here is very interested in not only putting their pricing on Pratter and not only seeing what their competitors get paid, but they want to do direct provider contracting with the self-insured companies that we're talking to. There's only three ways, right, that going into the future that self-insureds are going to lower their costs. It's going to be the direct provider contracting. It's going to be creating a healthier, narrow network, and also reference-based pricing. And our IT platform can facilitate any of those as the market evolves.
It's exciting stuff, Bill. You guys are doing some good work there at Pratter, and appreciate you being on here to discuss it. Any kind of final thoughts that you want to leave our audience about, as they, because I think one of the key takeaways you're talking about is that, employers are in the driver's seat. And employers, if we can get their light bulbs to continue to go off, they're the ones that's going to drive change. They're going to drive change back through the hospitals and provider system and through the insurance system. And then the consumer, too. As the consumer becomes more aware of these tools, they're going to begin to drive change. Agree? I mean, that's where change is going to come from.
You're exactly right.
So, Bill, give us some final thoughts, if you would, please.
We at Pratter, we're creating a network effect. With every new employer that onboards, everyone gets to see everyone else's cost data. It becomes that much more valuable as our database grows. So let us perform a free medical cost savings analysis. Enjoy it, use it, leverage it, and as long as there's a nice ROI for you, we're ready to do business with you. And we're publishing the hospital charges as well as the insurance company payments known as claim allowables. You get to manage what we measure, and we just love that opportunity to finally create the savings that we all deserve for the number 2 cost in our companies behind salaries, which is healthcare.
Bill, let our audience know how they can get in touch with you and the Pratter team.
Our website is pratter.us, pratter.us. Bottom left-hand corner on our team. You can email me or any other team member. Our telephone number's online, too. Every day's Pratter Day in our world. We're happy to talk with you and work with you.
Hey, Bill, thanks so much. Always great to talk with you and to catch up with you. And, we'll do it again real soon. Have a great weekend.
Hey, thanks. Enjoy your weekend, too. Appreciate you having me.
Take care, Bill.
Take care.